Welcome, everyone, to the HealthLinks podcast presented by the HealthLinks family of services. I'm your host, DJ Thatcher. Our mission here is to engage in conversations about the medical and wellness landscape of South Carolina so we're all better informed. Hey, in this issue, it's a topic that is a relatively hot topic with a lot of people, and it really emphasizes the aches, the pains that we can get, and how we can maintain just our optimal functionality at any stage of life. And in particular, what we're talking about here is that link between physical therapy and wellness. And we're joined by two experts in the field from XL Rehab and Sports, primarily located in the upstate. We're joined by David Bright and Jackson Killian. David, Jackson, welcome to the HealthLinks podcast.
Hey, thanks. Good morning.
Now, you are both physical therapists. We'll talk more about your educational background and so forth. But hey, give us just a quick overview of what XL Rehab and Sports is all about. David, I know you're one of the co-founders of this, been around for, a better part of 20 years, I guess. Is that right?
It has. We've been blessed in our area. It's funny, you look back to when we started, our goal was just to try to bring something that was unique in the sense that we were going to be patient-centric. We were going to be patient-focused. We weren't going to be driven by a return on investment model or a business model. We really just wanted to serve our patients in our community. And at no point did we ever expect to grow and have the opportunity that we've had. And it's just a blessing that we've had to be able to serve those communities and grow. And we wouldn't be able to do that if it wasn't for the trust and for our patients being able to support us through this.
That's good. We'll talk more about that in a few minutes. I know, Jackson, you are the clinic director now of a new location, right, in Greenville, South Carolina. Is that correct?
That's correct. So we opened that location up towards the end of last year. Mm-hmm. So I came on with Excel in the crazy year of 2020. And so it's been a good ride. So I started in the Clemson location and kind of got to see, just that true patient first mission in this location and how that plays out and the benefits patients see when we're giving them the care that they need. So just really excited to get out into a new community and try to bring the great care that we've been providing for several years in these different locations and just bring it to a new area out in the Greenville space.
Yeah, I know you're excited about that. Obviously, the population growth there is just amazing, like in many other areas as well. Hey, before we get into that, how about, where are some of your other locations? Because they're not just in the upstate of South Carolina, correct?
Right. We started in the upstate of South Carolina. We started in Clemson. We expanded into Easley. Then we went into Seneca. And then one of my roommates from college, Jeremy Shook, he helped us then expand into Chattanooga, into the Tennessee market. So I went to UT Chattanooga. Jackson went to UT Chattanooga. Jeremy Shook went to UT Chattanooga. So we do have some core people that are UT Chattanooga people. And Jackson actually did a clinical rotation in Chattanooga with Jeremy and wanted to stay in Chattanooga. And Jeremy said, you know what, head to South Carolina, spend a little time with David, and then if all else fails, come back to Chattanooga. Unfortunately, Jackson did not go back to Chattanooga. He stayed with us in the upstate of South Carolina. So we do have those 4 clinics in Chattanooga area, and then we just expanded into Fort Oglethorpe, Georgia. So it's just been wild.
That's good. Well, plenty of clients out there, I'm sure. So good for you for providing that level of service. So, hey, tell us about, you mentioned UT Chattanooga and your educational background. Some people are just not aware of everything that goes into becoming a physical therapist. So tell us a bit about that and your educational background.
Well, I'll let Jackson's the doctor on here. I
was going to mention that, yeah.
I'm the old school guy. When I went through PT school, I thought I was really upgrading to get a master's degree because the previous years were bachelor's degrees, and I thought, well, I don't want to wait. I don't want to be the guy that needs to upgrade after that. And then 2 years later, then they changed it to a doctorate program. So, Dr. Jackson Killian can then kind of speak to his program that was a little bit different than mine.
Yeah, what's that all about, Jackson? And hey, why are so many professions now at that doctorate level? A lot of the nursing professions and so forth. Tell us more about that.
Yeah, so I think I was kind of lucky. I went into undergrad thinking I wanted to go this route. So I went to the University of Tennessee in Knoxville for my undergraduate degree, and they have a kinesiology as their major that kind of lends itself towards physical therapy, occupational therapy, those types of things. So went through and did that, knowing that on the back end it's an additional 3 years of PT school, which I think ends up being about an extra 8 semesters of coursework, and then coming up on about a total of 3 semesters of clinical rotations where you're actually working alongside a physical therapist and getting some hands-on time treating patients and getting some good feedback from clinical instructors. And I think that's where you really are feeling out what works, what doesn't work, and trying to take that educational textbook knowledge and really apply that to people and forming those relationships. And you quickly learn people are not textbooks.
Sure.
You have all of these great ideas and it's supposed to go nice and smooth, and you got to pivot and be able to audible and have plan B audible in your back pocket. So that was a great learning experience for me. And that's where I kind of came into the Excel world. Was our last rotation is a 15-week clinical rotation to where we're treating patients full time alongside physical therapists. And I just happened to be paired up with Jeremy Shook in Chattanooga, and that's kind of how I came on board here. So it ends up being about a 7-year total program from start to finish. And it's a really good opportunity because we get to really hone in on the musculoskeletal and nervous system.
Wow.
Thankfully, we don't have to learn too much about all the other internal systems and all of that. So we really get the opportunity to become experts in the field and have some different layers of knowledge pathways to apply from a bony anatomy, soft tissue and muscle anatomy, and even into some of the neuroanatomy that we're finding really, really factors in to the pain experience patients are having.
Gotcha. All right. Well, Dr. Killian, thank you so much for that overview. It is a lot. A lot of people are not aware of what goes into just the educational background. I guess it's unfair, but a lot of people think, hey, a physical therapist is the person I go to who's going to help me to gain my function back or work with me with some exercises. And it's like an athletic trainer, a glorified athletic trainer, but it's a whole lot more than that. So tell us about, one of our themes here is that link between physical therapy and wellness. So tell us more about that.
One thing, DJ, that I think, and what I explain to a lot of people is personal trainers do help you get stronger. The biggest difference between a personal trainer and a physical therapist is our understanding of pathology. And when you take pathology, you take post-surgical care, and you take the understanding of pain. If you're seeing a personal trainer and you're experiencing pain, then if it's delayed onset muscle soreness, that's okay. That's normal for what you would experience working out. But if you're experiencing isolated pain in one specific area, you probably are not in the right place at that point. And you probably need to be with a physical therapist, because pain is the differentiator between normal function and it being abnormal. So as long as you're having pain in any specific area, it's going to shut down the optimal function of the body. You're going to move in ways that are not only not optimal, they're going to be compensatory patterns. And moving in those compensatory patterns are going to kind of create a little bit of a snowball effect. It may start off as, okay, I'm moving a shoulder. I'm hurting, but I'm kind of still moving. And then all of a sudden you go, okay, well, maybe it's not my shoulder anymore. Maybe it's my neck. And then you go, well, maybe it's not just my neck. Maybe it's my back. And then it becomes, okay, well, what are we treating? And a lot of times we'll see somebody in the clinic and they'll come in and they'll say shoulder pain. I mean, technically, this is shoulder pain, glenohumeral pain. But never do we see someone that only hurts in the glenohumeral joint. If you have glenohumeral pain, you have a lot of muscles that attach to your neck, you got a lot of muscles that attach to your spine. So if we're not treating the body, and that's what I think physical therapy shines at, we are one of the only medical professionals that actually treats the entire body from head to toe. So if you come in and see us and we do not treat you from head to toe. We just did you a disservice, in my opinion. And once you see a specialist, that specialist gets their microscope out and starts to hone in. A microscope's metaphorical, but they start to hone in on that joint even further. So you go, okay, I've seen the physical therapist. They didn't resolve it. Now let me see the specialist. And then the specialist starts to go, okay, let's put a specific diagnostic test and let's figure out what's going on inside of there. And once you reach that point, now we're looking for a problem. And then when we find it, we automatically go, okay, that's our problem. We need to fix that problem if there's a mechanical thing. And that could be, and we never want to discredit anything, but if the profession of physical therapy is doing their job correctly, we can ensure that when you see that specialist and they look at that one diagnostic test, they are accurately assessing what needs to be assessed instead of possibly a symptom of where that pain could be coming from.
Mm. So root cause, in other words. It sounds like what you're saying is there can be a continuum from, hey, some soreness that I'm getting because I'm just now starting a new exercise regime versus, hey, that specific pain I'm getting. So
sure.
Let's say I'm getting that pain now in my shoulder or in my neck up in here, for example, and I come to see you. How are you going to diagnose the root cause of that? What are some things that you might do?
Yeah, I think Jackson, I'll let Jackson, sometimes being the guy that's the old hat, everybody's worn the old hat in the area, but our new hats are amazing. And Jackson is one of those newer hats that people get to come in and see. And it's so funny because they say, David, I've seen you for 15 things, but man, Jackson was amazing. So that's our goal. I mean, if we're not hiring people better than us, then we're not taking care of our community. So
sure.
I'll let Jackson go there.
Yeah, go ahead, Jackson. How do we find that root cause of a problem?
Yeah, I think sometimes the old hat tricks work pretty good. I'll say that, but I think just number one, listening to what people are telling us. I think too often we want to get in there and start poking and prodding first thing, and sometimes we just need to sit back and listen. I think patients will a lot of times kind of tell you what's going on if we just actually take the time to shut our mouths and let them tell their story.
Sure.
And then once we get that piece of the information, it starts to present a bit of a clinical picture that you can kind of develop after seeing hundreds of shoulder and neck pain patients. But then getting into your clinical exam, and for me, as I think about treating people, I'm gonna assume the spine is the culprit until I can confidently rule out the spine as the culprit. I mean, everything kind of starts there. So if somebody's coming in and we're talking about shoulder pain, something as simple as just checking neck range of motion can be really, really eye-opening into what's going on. And as you have them start turning their head and looking up and down, they might say, oh man, that's really kind of producing some of that shoulder pain that I've been dealing with. And that kind of gets my wheels turning of thinking, okay, maybe it's not just your shoulder joint itself. Maybe we've got some cervical spine involvement going on here. And so that kind of hypothesis gets planted. And then we're going to kind of further test. And we're always reassessing and reevaluating as we're going through that exam. And it's almost like it's a scientific experiment of we got a hypothesis, and my assessment is either ruling in or ruling out that hypothesis as making it more and more likely. So as they're coming in, I'm gonna check their neck range of motion. If we're talking about shoulder pain, we're gonna look at how their shoulder blade is moving in relation to their arm movement. Is that contributing? And then getting into the shoulder joint itself, and we really want to try to stress that the shoulder joint itself in some different positions, and see if that is part of the problem. And just like I said earlier, humans are not textbooks. The truth of the matter is it's usually a combination of the three. And that's an important conversation to have with people, to say, hey, look, I know you feel it here, but when I do this and it makes you feel your symptoms, there's a good chance that those things are related, and we need to tackle both of those things. So I think just being open and upfront with people, and when you can demonstrate it and they say, oh yeah, I feel that, I think that builds a lot of credibility, and then people start to buy in. They're like, okay, I can buy this story that you're selling. And then, part two of that is as you start to treat, we're going to get them back up. And within that first session, we're going to reassess what we did initially. And that, again, it gives us some good feedback to say, yeah, we're on the right track here, or no, we need to take a step back and reassess. So I think overall, just really listening to patients and their story, and then doing a good detailed assessment, not just of the joint itself that we're having pain in, but the joints surrounding it as well.
Prioritize your health with a subscription to HealthLinks magazine. Get every issue of HealthLinks delivered right to your door for only $15.99 a year. 6 issues packed full of local factual health information to help you be the best version of yourself. Subscribe now to HealthLinks magazine. Visit subscribehealthlinks.com. That's subscribehealthlinks.com. HealthLinks magazine, the Low Country's prescription for well-being. You're watching the Health Links podcast.
It's also interesting in the fact that a lot of people who are experiencing any kind of an issue with pain and so forth, their first reaction is to make an appointment with a physician. So it might be an orthopedic surgeon or someone like that. And then they think they have to get a referral then to a physical therapist. That's not the case anymore, is it? People can go directly to you, if I'm not mistaken.
Yeah.
So.
And when you think about it, and I think that's a great point, DJ. We often think, okay, well, I want to get this problem to go away. And for anybody that's had back pain, neck pain, any pain anywhere, number one, let me take something for it to make me feel better. Number two, let me fix this problem if it's not getting better on its own. And we want to expedite that. Everyone that's listening will know living with pain is terrible. Like anything we can do to expedite someone getting out of pain that's important. But I think that overutilization of medication, even maybe overemphasizing the effectiveness of a surgery as a early line defense. And this is nothing against surgeons. Surgeons are absolutely necessary. But if we're using that as the second line defense for your problem, we're not doing you any help, because we know diagnostically there are people that have very terrible MRIs or X-rays that are living pain-free. So that tells us something. It tells us that diagnostic testing is important, but it's a piece of the puzzle. And if we take only one piece of the puzzle and we tell you what the problem is, we're probably missing the forest for the trees in some situations. And as Jackson mentioned, because physical therapists are one of the few professionals that treat extremities, medical professionals that treat extremities and the spine, if we're not a part of the equation early on, you can end up going down a rabbit trail that's going to cost you a lot of money, and you could end up being in a position, and we're in that position now with medicine as we know it. As medicine gets more and more specialized, it becomes more and more expensive, but it also becomes further and further from getting the results that you're looking for.
Makes sense. Yeah.
If we see a physical therapist early in the sequence, we can become part of that team, your medical team. And our goal is never to eliminate anyone from your medical team. It's to pull everybody together. So let's consider that your family physician is your quarterback. We want to get the ball early from the quarterback because we can run with the ball, we can catch the ball, and we can even decide to hand the ball off. We can lateral it to somebody else, versus once you see a specialist, they've caught the ball and then they decide, okay, we drop back and punt, or we've got to move that ball to somebody else. But it's not as quick as a handoff. And don't get me wrong, we see plenty of referrals from specialists. We are super integrated in how we want to be collaborative in our care as physical therapists.
Sure.
But I do think that we are a profession that's thought of as a technician that will do part of the work that the physician tells them to do, instead of that doctorate level degree that has been earned, that is a true diagnostician in a lot of ways. We're part of that diagnostic team to help that quarterback decide, okay, where do we go from here? And it's never meant to be, rank. We all need to really be on the same level to better serve our patients. And when there is rank, and as you know, as an RN, DJ, sometimes it can be more about rank than it can be about serving our patients. And that kind of comes back to that patient first mission and going, okay, are we helping our patients, or are we kind of serving the system? And we want to be in that place that we go, it's all about the patient. So yes, let's have a harder conversation. And let's say, yes, we need to see you early. And yes, you have direct access to us, but we never want your direct access to us to become exclusive of your collaborative care model that we also need to ensure that you're not going to stay with us for 9 months and not get better. You need to see results in 4 to 6 visits with me, or I'm not doing my job. And maybe we need to get some medicine into the equation, and that's not my role, but I can work with your physician to get there. Or maybe we need to have some more diagnostic testing to identify exactly where, what's going on there, and maybe we need an injection there, and we're going to work with your specialist or orthopedist to get there. So I think the more collaborative we are in medicine, the less money that's spent, and that's good for all of us, because the higher the spending, the more the insurance premiums become, but also the better the outcomes for the patient. And if that's really what we're all in it for, then we're serving the patient. We're not telling the patient, and we're not serving ourselves in that equation.
That's great to hear. Hey, on a side note, I have to ask, did you both play football? You've both used some good football references there. So has that been part of your background?
If you could see me off screen, you would know really quickly that my 5'8" and 150 pounds doesn't correlate so hot
Hunter,
to football these days. I do good sitting on the couch and cheering.
Sure, yeah. Jackson, one thing you said a few moments ago was about the time that you spend with patients. I know in my own world, I had a knee injury just a couple of years ago, and it wasn't a big deal, but I thought, hey, I should probably have this checked. It was nagging for a while, but I should have this checked by an orthopod or orthopedic surgeon just to see, what's going on. And I called, and it was like a 6-week wait to get there. And their office actually said, hey, why don't you check in with physical therapy first? Because the surgeon's probably going to refer you to the physical therapist initially anyhow. And long story short, hey, I did get some therapy on the knee. Only took a few sessions, like you just mentioned, David, and never had to go see that orthopod. But is that it's kind of something that's a reality in your world as well, that if people can come see you first, and then, as you said, David, refer to that surgeon if you need to.
Right.
Yeah, I think it's great when it works out that way. And oftentimes, I mean, there are times when it's like, look, physical therapy is not the answer for this condition that's coming in, but it's going to put you in a better position when you do go meet that surgeon, and we need to go a different route. I mean, whether it's you're at a stronger point, your pain is down a little bit, your range of motion is better, at the least, what we can confidently say is you're going to be in a better spot going into that appointment or potential procedure than you were if we had done nothing for 4 to 6 weeks, waiting to get in there. But on the other hand, there's plenty of times that people come in that waiting period, and they're already getting better just through the course of natural history of injury, and then add in some exercise, add in some manual therapy components to try to get that pain down, get the joints moving better, get the muscles to relax. And they find, hey, I'm feeling good. I don't think I even need to go the route.
Right. Yeah.
So I think just knowing, hey, coming into physical therapy doesn't mean everything else is off the table, but it gives me easier access. And hey, what I love about this profession is we get to spend time with people and get to know people and what is important to you to get back to. I see most of my patients for at least 2 hours a week, maybe 3 hours a week. And we can really figure out a lot of stuff that's going on during that time, and find an individualized, personalized plan of care to help address what they want to address while they're working with us.
It's interesting too, because, and again, as you said, orthopedic surgeons, other physicians are terrific, and we need them. It would be unusual to spend that much time with a surgeon, though, including the operation. So you are able to dedicate more time. Yeah.
And DJ, you bring up a great point, and I was going to say the same thing. Someone came in and saw me, and after 2-3 visits, I said, okay, I think I got a sense for what's going on here, and I think it's a little more complicated than we first thought. I think you have 2 or 3 things happening, and each of those things is feeding into the other, and we really got to figure out which one's feeding in first, because if we can take it down, then the other 2 will calm down quicker. And they said, David, that's wild. Why didn't my orthopedic surgeon say the same thing? And I said, tell me how long he saw you. Well, and what I said was, tell me how long he got to see you, because that's really important. It's an important distinction, because I don't think the system is set up the same way for each of us. And it's very interesting because Jackson and I, like he said, we get to spend an hour with our patients each session that they come in, and you can learn a lot from them then. And honestly, if an orthopedic surgeon got to spend that much time with you, he would have figured it out long before I did. So it's not that I have an advantage in what I know, I have an advantage in how much time I get to spend with you. And
Nice.
Instead of me in 10 minutes having to diagnose you and figure out what to do with you, I have that luxury of spending 3 hours with you over 3 visits and going, this is what's happening. It's completely different than I initially thought. And how it presented, and your pain here has now morphed into pain here, and pain here. And now we can treat it way more effectively because, as you mentioned earlier, DJ, the sternocleidomastoid muscle, a muscle that sits up in here, it kind of describes where it's attached. It goes from our sternum to our clavicle to our mastoid. And it's a very interesting muscle. It's one that Jackson and I have kind of been focusing on lately because we're recognizing we've probably overemphasized the mechanics of the body and we've underemphasized the neurophysiology. And when you think about it, and you go, well,
now, what's the difference here, just for the average layperson? You hear that, what does that mean?
Yeah. So mechanically, we think of muscles and bones. And we think, okay, muscles attached to bones, you got bone attaching to bone through a ligament, and it's mechanical. So what's it doing mechanically and structurally? And there's a lot of importance to that. But more importantly, and probably as importantly, is the neurophysiology tells the muscle what to do. And if we're not thinking beyond just the mechanics, no one ever walks in to physical therapy without a nervous system. You just never will do it. You've got to have a nervous system that's functioning correctly to even tell you when you're hurting. And most of the people we see come in because they are hurting. So as long as you have pain, the neuromuscular system will be working in a suboptimal fashion and will be creating guarding, will be creating spasm, or be creating compensation. And if we're not thinking about that and how we're going to treat that and how we're going to make that a component of your care, we're treating the body as if it's mechanical, like it's a robot, and it's not. Our nervous system is so complex that we exclude it a lot of times because we don't understand how it all works. But the beauty of physical therapy is we have the opportunity to include it, to think of it as, okay, neurophysiologically, your sternocleidomastoid, mechanically it attaches to those points. But why is the tone more on that side of your shoulder that's affected than it is on the other side? Is it a symptom of the problem? Is it part of the cause of the problem? Or is it just aggravating this problem and keeping it from resolving? And I know if my sternocleidomastoid muscle is tight, my shoulder pulls forward. And if my shoulder pulls forward mechanically, it cannot operate in a great position to not hurt. So if I treat here where I don't actually have inflammation, but I can resolve this to get this less inflamed, man, I can do some great stuff. And I think that's what we're seeing in physical therapy land is we're treating the body instead of treating your symptom, and we're working collaboratively with your other medical team to do some really fun stuff and put us all on the same level to best serve our patients.
That's terrific. You know, a lot of our conversation here is revolving around head, shoulders, back, and that sort of thing. Obviously, you take care of knees, hips, and all the other joints as well. But it sounds like so many problems that people are having, especially with chronic pain or functionality problems, have a root cause in these areas. Is that fair to say?
Yeah, and I think another piece that goes into it as we think about the nervous system as a whole, what we're finding, and especially as you mentioned, DJ, with chronic pain, there's so many other levers and factors that go into that than just this one spot in my back or this one spot in my neck or shoulder. You know, what we have been trying to work on and talk with people about are what does the time outside of therapy look like for you? 2 to 3 hours a week out of a 7-day week is not a lot. So what does that other time look like? How are you sleeping at night? Is your sleep affected? Do you have a consistent routine associated with that? What does your diet look like? And we're not dietitians by any means, but just having just a basic conversation of, are we eating the things that we should be eating most of the time? What does our general activity look like? Are we moving throughout the day, or are we spending most of our days sitting still? Do we know the American Academy of Sports Medicine's physical activity guidelines? A lot of people are not familiar with those things, and those come out of 150 minutes of moderate activity, cardiovascular exercise over the course of a week, and that can be broken up into 5 30-minute walks or 10 15-minute walks throughout the course of a week. Okay. And then trying to get 2 days of muscle strengthening exercises and 2 days of flexibility exercises, and trying to promote that physical activity level. And then I think what we found really strongly from 2020 was, what are your social interactions like? And trying to promote those things as well. And all of those factors really factor in to the overall pain experience people are coming in to see us with. So trying to hit on the mechanical side, from the muscles and bones, the neurophysiology side, and can we get that kind of calmed down? And then those lifestyle factors, which I think really is the next phase of this physical therapy, and moving it into that wellness side of things as well.
Hey, Jackson, you mentioned you came on board during COVID. I'm sure there's a night and day difference between when you first started 2020 to now, with just how weird everything was, or different everything was during COVID, I guess. Right?
Yeah, you never realized how much you miss seeing people smile until you wear a mask for a year or however long it was. But I just think we found big time how much social isolation can really just ramp up pain. And if you're in that and you're feeling alone, it's a bad place to be. And I'm just thankful that we're in a profession and position that we can be there for people and spend that time and try to invest in helping them not only get better while they're working with us, but how can we change your life, a year, 2 years down the road for the better.
Did you happen to get clients who come to you who just want to start an exercise routine? They want to get into shape. You mentioned a moment ago about nutrition and that sort of thing. And you always see these warnings, consult with your doctor before starting an exercise routine. But is that something you have the bandwidth to do? Just somebody who's really not having any particular problem, but they want to do it the right way. I don't know if that's something you do or not.
And I definitely think that we can, DJ. And if anybody is well equipped to help you to navigate that process, then I think physical therapy is that, because yes, we understand pathology, but we understand biology. And if you have done anything on Instagram and you have looked at anything regarding your health or wellness, you will be bombarded by the algorithm that has decided to feed you everything. Well, and we talk about what we eat. We got to also talk about what we put into our brain, in the sense of, you got to know what you don't know, and you got to know what you do know. And the reason that wellness has been moving towards $1 trillion industry is because we are consuming so much, but we don't even know what to consume. And Jackson and I will laugh, and I'll send him, I'll share something on Instagram with him. I just did it last night. These are experts that are telling us what to do. And I'll say, I don't know how this person became an expert, because this is wrong. This is wrong information. And having someone that you have a relationship with that you can trust, that will tell you when they know and when they don't know. And when they don't know, they're going to bring along somebody that they trust that does know. And physical therapists can do that. And, it's not rocket science. We have made this into the hardest thing that you could ever accomplish. But the reality is, health and wellness is not hard to know. It's hard to do. And it's hard to do it consistently. It's hard to find a way to do it so that it's sustainable. And we have to find a way to get there that's going to be different for each person, because our obstacle, sometimes is our body, but a lot of times it is our lack of success historically. And
Wow.
if you can work with someone that can help you overcome that, you're overcoming so much more, because you could have been overweight since you've been an adolescent. You're carrying much more than just your weight. You're carrying your past failures. You're carrying your inability to overcome this problem, and you're going to carry that into the next thing that you're going to consume or purchase to get out of it. And if that thing is trying to take advantage of you, if it's trying to help itself, if it's a thing that is trying to benefit, if it's the next Tybo, if it's the next home gym, if it's the next Gazelle, that's not the problem. It's not what you can do. It's, are you going to do it? And are you going to work with someone that when you have pain, not if, but when you have pain, are they going to know how to get you out of it and back on the road? And when you're back on the road, how are they going to keep you on the road? Because the ditch calls your name. It's like pulls you in with a gravitational pull like a black hole. But we can stay on the road by having someone in our corner that's not trying to benefit from us financially or through some other means, but is serving us in a way that what we need is what they want us to do, instead of we're directing, or someone's directing you into a path that benefits them instead of you. And, never to create fear, but to create an understanding of what we're up against. We're going through a cornfield maze every day with health and wellness, and you're going to see everything. I mean, you need to do intermittent fasting. You need to go keto. You need to go low carb. You need to go low fat. We've done it all. And if we were successful with these programs, all of us would look healthy. But it's hard. We're less healthy than we've ever been. So we need physical therapists to rise up and to take charge of what we are, which is we are the movement experts that are the body experts that treat the body from head to toe. And we're not just going to treat pathology. We're going to use wellness to help you get out of the ditch, back in the road, and travel them at the highest, most effective speed and pace you can get to.
Jackson, as the clinic director now of the recently opened Greenville location, I know, of course, not only there, but across all of Excel Rehab and Sports, you've got this patient-first approach, which is kind of going back to, I mentioned I had a 6-week wait to see a surgeon, and yet I got in, I think it was the next day, with a physical therapist. Same thing there. I guess it's all about making it convenient for scheduling, seeing the same therapist, reducing the wait times and so forth. Anything else that falls under that patient-first concept for you?
Yeah, I think you hit most of the things there, DJ. But I think, like we talked about earlier, just being able to listen to patients. I think so often when we go in to see different doctors or different specialists, it's a lot of the specialist talking and the patient listening. And so I try when people come and see me, at least on that first visit, I want to listen and let you tell me your story. And then from there, there's a lot of good info in there. And oftentimes, if you listen close enough, they'll tell you how to treat them and how to make it better. They've already found some things that make it better. And we just have to capitalize on that. And sometimes it's getting into that manual therapy, hands-on approach so we can put the pain fire out so that then they can do more. If somebody's hurting really bad and you just, had a knee tweak or something like that, it's probably not a great idea to go grab a 300-pound squat and say, if we strengthen your legs, you're going to get better. Not a great idea.
Sure.
But trying to tone it down that way. And then, like you said, seeing the same therapist every visit is critical. I mean, from the therapist perspective, we know what we did, and chances are it either made you better, it made you worse, or it didn't change anything. It's one of those three options, and all three of those are important. If it made you worse, that tells us great information that we're working on the right stuff. I just overshot it a little bit, and I apologize, and I got to back off some next time. If it made you better, everybody's happy.
Right.
I hit the target there. And if it didn't change anything, I got to reevaluate my game plan. I either didn't do enough, or I'm not even treating the right area at all. And so that's really important to have that same therapist every visit, so that the therapist can, make their hypothesis and refine as we treat, but it's also important from a patient relationship perspective, because there's things that come out 6-7 weeks into a plan of care that never would have come out day 3 of a plan of care, that really start to open up. Hey, maybe there's more going on here, and how can we help and better address that issue, which may really be more of the root cause of everything, even more so than I thought. So I think the relationship piece is just so big.
Absolutely. And I've got a great example of that I just thought of. And this is kind of one of those that is very interesting. And it's that journey that Jackson described. So I had a young person come in. She's college age, comes in with a left ankle sprain. And she's training for an Ironman. So, I'm going to help that ankle sprain. It's pretty obvious. She sprained her ankle. It's swollen. I need to help her ankle. Yeah, that's great. So we're working with her ankle. Her ankle's getting better. She's able to go back and do some stuff. And she returns back to running to train for this Ironman coming up. And her right knee starts to hurt. And I go, okay, that's one of those things that we deal with sometimes. We go, okay, let's do this. Let's go 80-20. Let's kind of switch gears a little bit. Let's stay 20 on the ankle. Let's now spend a little 80% of our time on that knee and figure out, because that's going to affect her run more than that ankle, because the ankle's a minimal problem now. So we start looking at the knee and we go, there's some stuff going on here that's interesting. Yeah, your knee hurts and it's swollen, but why? And if we don't get to the why, then we're just treating the symptom. We're not treating the cause. And as we get to the why with her, after 4 or 5 visits, it starts to get down a little deeper. And Mom says to me, she goes, she's always turned that toe in since she was a baby on that foot. So if you could help her with that, and all of a sudden, like the light bulbs went off, and I went, oh, okay. So now we start to look at it, and yeah, she had a back issue on that side, and it was shutting down her glute that was affecting her knee. But even more importantly, she had this tone, this increased muscle tone in her adductor, which is the inside, kind of where her groin is. And all of a sudden, we start treating that, and the toe in on the right side starts to go away. We open up that hip, and we strengthen the hip, and we strengthen the core. And instead of us chasing it, now we're getting it, and we're getting traction with it, and we're instead of like bailing water out of a boat. So what starts as a left ankle sprain in PT land can turn into this toddler symptom that affects us as we go forward. And that's why we love what we do, is we get to be a detective every day we walk in, but we get to be a detective that loves on our people and that loves building those relationships. And I always tell people, if you want to go into physical therapy and you don't love people, you don't need to be a physical therapist. Right. Because you're going to spend so much time with people. And I had an orthopedic surgeon one time laugh at me, and he said, "How long did you see this lady?" I said, "I saw her 1 hour each time, and I saw her 18 visits. I saw her 18 hours. He goes, "Oh my gosh, how do you do that? That would drive me crazy." I said, that's why we are different. I said, you have to put people to sleep to spend time with them, because they drive you crazy, and joking with him, of course. But they actually will stay awake and not have to be under anesthesia for me to spend an hour with them. And, obviously we're going back and forth. This is someone I know well, but it is a gift that physical therapists have. And I think it's an opportunity where we get to serve that patient in a way that we build a relationship. And it's funny, you would think, okay, you got to spend an hour with me, I'm going to get paid 5 times as much as the guy that you spent 10 minutes with. But it's funny, we actually get paid about 1/4 of the guy that you spent 10 minutes with, just because of the way the AMA, the American Medical Association system works, and how we lobby. That's a whole other podcast. Exactly. I'll stay out of that rabbit hole.
Oh, I got you. We can, for both of you, we can see and hear the enthusiasm you have. So, gentlemen, this has been very insightful. And I think people who are watching or listening to this podcast may very well say, this makes a whole lot of sense. I've been dealing with fill in the blank, and I should probably go see a physical therapist. So thank you so much for joining us. Again, we're joined by clinic co-founder David Bright, a physical therapist of Excel Rehab and Sports, and also by physical therapist Dr. Jackson Killian. And gentlemen, thank you so much for joining us here on the Health Links podcast.
Thank you, DJ.
Thank you, DJ.
Thank you for joining us for this episode. Remember, the Health Links podcast is presented by the Health Links family of services. Now, to gain access to anything related to HealthLinks South Carolina, check out our website at healthlinkssc.com. And to listen to any of our nearly 100 podcasts, simply put a /podcast in front of that website. You can check those out as well. And to reach me directly, perhaps for comments about our guests, or maybe suggestions for future podcasts, love to hear from you. You reach me directly at host@healthlinkssc.com. Once again, I'm DJ Thatcher. Thank you for joining.